All right, good morning and welcome everybody. We're so excited that you're able to join us this morning for our Medicare 101 talk. We know that Medicare can be very confusing for everyone, and we really want to help people understand, especially how it relates to our community here in Wrightful and our surrounding areas in our region. You know, what are those different things that you need to understand about Medicare? So I'm very excited to have our speaker today. This is Pam Ruzicka, and she is with Insurance for You out of Glenwood. She does do, well, I'll let her describe that.
Yeah.
One quick thing I want to mention real quick is that we have an interpreter here that can help anybody if anybody speaks Spanish, or Spanish is a native language for anybody, but just want to know that you have that available.
Si alguien ocupa interpretación al español, aquí pueden venir a agarrar un aparato.
Okay. All right. Well, thank you. In addition, we have some other members of our team here from Grand River that can help answer questions after Pam speaks regarding our nursing home, our swing bed program, and our patient financial services. And somehow, you know, if you have questions about how Medicare relates to some of the bills that you get from us. So with that, I'm going to turn it over to Pam, and thank you very much for coming.
All right. Well, welcome on this cold morning. I drove in from Glenwood, and the cars are backed up past Newcastle trying to go east, so I don't recommend going that way for quite a while. I'm going to start stimulating your economy after this meeting because I'm not going to be in a hurry to get back home. I've been working with Medicare since 2002. Started self-educating myself, and now I certify every year with CMS, which is Centers for Medicare Services, just to stay on top of what's going on and try to stay ahead of what's changing every year. I thought we could just do a basic about all the parts of Medicare because it's very confusing. So if you have questions, if you want to just ask them. We're a pretty casual environment, or raise your hand if you're shy. But we'll start with A and B. So those are the two parts that we get from the government. A, you have paid into all of your life with a little thing called FICA. So they tell you that it's free to you. A, they call hospital, I call inpatient, because it includes hospital, nursing home, and hospice care. So anything where you're admitted and not getting out or leaving right away. In the past, all of these surgeries that are now outpatient surgery used to be inpatient. So, you know, if you had shoulder surgery, you stayed overnight, knee surgery. Now it's outpatient. So Part B has become significantly more important because that's most of our services for a lot of people. Part B for this year is going to be $175 is what I call it. I don't like all these weird numbers that they use. But Part B has a deductible of $240 a year, and after that it's 80-20. You pay the 20. Included in Part B is all your lab work is covered 100%, doctor's visits are under that deductible and 80-20. Also durable medical equipment. So people on CPAP who use oxygen, all of the crutches, wheelchairs, and devices that we need is all under B. So questions on Medicare itself. You guys are going to have to warm up a little. Okay, so then after that, if you want help, because the issues with A and B, there's no cap on your out-of-pocket. So you could have a huge bill, 20% of whatever you're having all year long outpatient. So you want to get something to sort of protect yourself. So you get option number 1, which is the 2 little orange columns, or you get option number 2. Option number 1 has been available in our valley since Medicare came about in 1965. Supplements work everywhere in the United States that take Medicare. So if you're a traveler or have family in different states, that's pretty important and helps people make a decision on what they want to use for their decision making in the future. In addition to that, we got drug plans, which are part of Medicare Advantage. So we got those 15 years ago, 12 years ago maybe, with Medicare Advantage. And that's what's part of open enrollment, which was on the bottom right of your columns there. Open enrollment starts October 15th through December 7th. So we're just coming to that window where everyone can change only the drug plan or the Medicare Advantage plan. Medicare supplements typically have a lower out-of-pocket than the Medicare Advantage plans, but they cost more per month. So you got to weigh what's going to work for you and what are you going to need in the future, which is having a crystal ball, and none of us do. That's the problem. The drug plans, every year they change the drugs they'll cover, they change their premiums. There were 24 of them in Garfield County in 2024, and that reduced down to 19 plans, I think, for 2025. Because of some of the changes the government has been making, companies are not offering drug plans anymore. So it's whittling down who wants to get involved and play games with the government, basically. When we get to just the drug plan itself, they raised the deductible this year to $590. And after that, you do co-pays until you hit $2,000. That's new this year. They put a cap of $2,000 on the drug plans, and that's kind of why some of these insurance companies are not offering them, because now they have to pay more money. It's great for the consumer who's on a very expensive drug, like Ozempic or something that is $1,000. You have 2 months, and then you're covered for the rest of the year on all your meds. So it's good for people who are on expensive meds. The donut hole finally went away. You know, we've been hearing about that for over 10 years, how they're going to take away the donut hole in the drug plans. And that finally got removed in 2025. So that's also helping out that $2,000 limit that we've got now. Yes?
What's the donut hole?
The donut hole in 2024 was there were 4 stages on the drug plan. Deductible, stage 1, then you got to the donut hole, where you paid more. Once you got past a certain threshold of amount, I think it was like $5,000, you paid more until you got to $8,000, which is what it is this year. And after $8,000, you're covered 100%. That's for 2024. So the donut hole went away. So once you meet that $2,000 for the year, you're covered by the drug company plan that you choose. And again, whatever plan is going to work best for you, it depends on the medications that you take, because they all have these things called formularies. That's the list of the drugs they take. So you're going to want to check and make sure that plan, because if you go into Medicare.gov, you'll see the first plan that shows up is $0 a month. Well, that sounds great until you put your medication in there and it's not covered. And so you just pay full price all year long, and you don't get capped at the $2,000. So you got to put the whole thing together with the price per month and the price of the drugs at your favorite pharmacy, and it's mumbo jumbo. Medicare Advantage. So this is a thing that has been in Garfield County 3 years. What it does, it takes over for A and B, and it throws in some supplement and a drug plan in a bundle, and they make it sound all great on television. Don't believe what you see on TV, my first word of advice. It is here. We have one plan. It's $0 a month, and your out-of-pocket for next year will be $6,700. So high out-of-pocket, you get there through various co-pays to doctors, x-rays, anything that you're having, outpatient surgeries. There's co-pays for everything. They also will tell you about their dental and vision plan, which they do have a dental and vision plan. You have to go to Grand Junction or Denver to use it. So if you know what you're getting and you're educated about it, you can make that plan work for you. Take a whole day and go to Junction and go do your dentist and your vision, and And they only have certain doctors that are covered. So you would definitely want to check their website or the app on your phone to confirm if you're going to go see a doctor that they take your plan. I've got a few people in Glenwood that have wanted shoulder surgery by Leota. You may have heard of him. He's not on the Medicare Advantage. So I think they found someone in Rifle who would do their surgery. So you just got to play the game if that's what is going to work for you. And only person who can make that decision is you, based on what you know now. What else you got? Questions?
What did you say was the max on that one?
6,700 for next year.
So, 6,700.
Yeah.
So if you enroll in a Medicare Advantage plan, say next year, can you switch back to traditional Medicare the following year?
You have 1 year. You have, well, okay, this is where it gets complicated. You can apply for the Medicare Advantage during this open enrollment. In that time, if you have a drug plan, by enrolling in the Advantage, it's going to cancel your drug plan. You would have to cancel your supplement if you've got one, and then say you don't like it. So you have 1 year to come back and get a supplement without medical questions. If you go longer than a year and you say, now I want to switch, you can go try to apply for a Medicare supplement. Most of the time, people, when you're ready, you think you want one now, you've got something going on medically, right? Well, then they're going to say, well, we'll take you, but we're going to rate you up twice as much. Or no, we won't take you at all. So it's very wishy-washy to know what to decide now. Because your future, I wish I had a crystal ball. Life would be so easy, but we don't. Yeah.
So what are the medical questions?
First,
What are they looking for?
the first few, I know the primary one that gets a lot of people kicked off right away is, have you been inpatient in the last 2 years? Do you have a surgery that you've been told you need that you haven't gotten? And they get you, you have to sign a thing that says, yeah, go get my records. They're gonna find it, whatever's in there, and they're gonna check your medications to see what you're taking drugs for. So they have a pretty good idea. So you can't really fib. Yeah.
And so you're answering those questions for a variety of.
Yeah, then they get into the nitty-gritty of, the heart. They go through all the parts of your body, and you got to answer all the details.
Yeah. And it's not just, you're not just trying with one supplement provider, you're trying with.
Well, each one has their own application. So yes, you would have to try one, and then once the first one rates you up or declines you, and you say, oh, I don't want it, you go to the second one. Now you have to tell them that they rated you up or declined you. So I don't know. It's complicated. In the supplement column, you can see the different levels of coverage that is available. So you can protect yourself anywhere from just the $240 deductible up to what's the highest is like $7,000 out of pocket, but you're still covered everywhere, in the United States. And a lot of people around here, we go south or we go to Utah, yeah.
That's why I'm here.
Yeah.
I don't know what to do about that.
Yeah.
What do you want to have if you travel in different states?
Then you definitely want option number 1 with the separate drug plan, because of course there are penalties. If you come on Medicare, I've got a lot of people who say, I don't have any drugs, right? I don't want a drug plan. Well, luckily, this year we got a plan that was $0 a month, and it's staying for next year. So we just put all my people on $0 plan, because if you don't have any meds, at least you're protected from the penalty that they will impose because you didn't have a drug plan. Yeah.
Is adding D an extra cost?
Depends on which plan. Like I just mentioned, there's a $0 plan. So it depends which plan is going to cover your drugs. So it's impossible to answer until we put all those in the computer and it kicks out. And it knows the prices of every drug plan at every pharmacy. It's amazing. So I have people that shop pharmacies too. They want to know if they can save at one or the other, or.
So it's a matter of calling We're
No.
looking.
If you want to switch pharmacies, your doctor has
No,
to
no, no,
change.
Not to switch pharmacies, but to add and find out if the drug you need is available.
It's all on the website of the drug plan. So if you have a drug plan, you can go look up 2025 formulary. Why don't they just call it a drug list so that people can find it? They have to use all these names that are impossible. But it's on their website or on their app if you have the app on your phone for every plan. Those just all came out on 10/1, so it's hot off the press.
So what is the range that you'll find? Say if you went with Plan G and there are so many companies that
Yes,
offer the
yes.
supplemental Plan G.
Yes.
But I know the spread can be enormous. Is there any reason other than that's what we're going to charge? The plan is the same no matter.
It's all dictated by the government and that Part B deductible. So the government has designed Plan G, we'll call it. So Plan G is a G with all the companies, all the same. The only thing that differentiates most of my clients from choosing one or the other is if they offer the free fitness. Now, no offense to the gentlemen, but usually the women are the ones that are kind of more interested into that. So that will dictate if that narrows it down to three companies that offer the free fitness. So that's it, because they all have to cover the same exact coverage. And you'll talk to all your friends, and they'll have a certain one that most people have, and you'll be like, well, I want that one. So if you talk to people, they'll tell you.
How large is the range that you'll find? Like, for instance, with just Plan G among the insurers,
Right.
how big a spread can that be?
For Plan G, if you're 65 right now, I think it runs from $120 a month to the highest I've seen is $155. So it's not
I'm
huge.
80, so what would it be?
I'd have to look that up.
Higher,
Yeah,
no doubt.
yeah,
Guinea pig with her.
yeah. Yeah, and if you don't have it now, you'll have to answer all the medical.
Right.
Yeah.
right.
But yeah, we can take a look at that. What you got?
So Medicare A, that's mandatory?
It,
Unless
it's
you
provided.
Unless you opt out and then you get penalized later, all that kind of stuff. But A and B are mandatory, that we need to get in there and do it? Or?
B, you will be penalized if you don't get B when you turn 65.
So A, you have.
A, they give to you automatically.
They charge you, but they.
Yeah, you've been paying.
So they give to you, and then B, you get penalized if you don't?
You get penalized if you don't. But if you have employer insurance, that counts in your favor. So if you're going to work till you're 70 because now you don't want to take your Social Security until you're 70, you're fine. You don't have to take B because you've got creditable coverage protecting you from that penalty.
Okay, how about D?
D, if you don't have employer coverage, you will be penalized if you don't get a drug plan when you come on 65.
Any other ones that would fall under also? So A, B, and D, you have to address either way.
A is automatically going to start on the first of the month of your birthday, and they don't even tell you.
Okay, B and D, though, are the only other two? Okay, thank you.
Yep.
So how many Grand River doctors don't take Medicare Advantage?
I do not know that. Do you know that?
You're gonna ask Marissa or Megan.
You know that?
All Grand River doctors take Medicare because when they work here, they sign over their billing rights to Grand River.
So they're under the hospital umbrella.
Yes, the only time that's not true is if they're a traveling provider and they come from another facility. So if they come from, say, Valley View Urology comes over here and they see you here, or they do a procedure in our OR, if they're not participating with that plan, then you would not get coverage. You would
Right.
have Medicare Advantage coverage for the facility part of your bill, but not the provider part of it.
Right. Good questions. Keep them coming.
I have noticed that some of our doctors aren't on the website, but you're saying they're still
Yeah, if they're
covered.
employed
Like
by Grand
Cotter's not
River.
on the website.
Who?
Dr. Cotter.
Yeah, if they're employed by Grand River, they sign over their billing rights to Grand River, and under our tax ID, we are covered through the Medicare Advantage plans that are in the valley. Great.
So any of the specialists that come from Valley View, they're not covered? here?
Not necessarily, they can be through Valley View. I would reach out to the provider's office and ask them if they're participating with the Medicare Advantage plan of your choice. If they are, then yes, you would be covered at Grand River. If they're not, then you would have to pay the physician fee. But the facility fee for whatever space you used while you were here would be covered under Grand River.
There are physicians that come here and they're employees here, and there's some that aren't. Is that correct?
Yes, right now, there's only one, and he's our cataract doctor.
That what?
Oh,
That's
cataract doctor.
cataract
No,
doctor.
but that he is or is not.
He is not employed by Grand River, but he uses Grand River's OR to do his surgeries.
So everybody else that's in specialty, it does that billing deferral for
Yeah.
Grand River to cover it. So
Yeah.
basically everybody here.
Yeah.
Okay.
There is one additional, it's Dr. Hahn, who's a pain specialist, so he also is in that category as Dr.
Okay, so not Medicare, that's good.
Yeah.
You'll be able to find somebody.
Cover.
Yeah.
They just might not be in town.
I got cataract and
What else? Yeah.
I'm on Medicaid before Medicare.
Okay.
Where do I go there?
They have a dual eligible Medicare Advantage plan for Medicaid, Medicare people that's through United Health and Rocky. So you automatically would get on that and you get better coverage than the regular plan that I was speaking of. Yeah. What else? Yeah,
Compared,
do it.
what's your opinion of AARP as a supplement?
I don't have any complaints of it. No one calls me and complains ever.
Do you recommend it as one of their, like when you have somebody walk in your office, do you?
I present it. I don't ever tell anybody this is what I would get because I can't do that. I'm not going to do that. So I show it to them, and if you've talked to all your friends, that's what they all have, most of them. And so a lot of people just say, I want that one because my friend has never had a problem. They pay the bills and they're easy peasy. Plus they offer the fitness.
What's the fitness, just a?
You get free classes and free memberships to some of the local facilities. Yeah.
I will say from a billing standpoint, AARP is one of our payers that we don't have problems with typically.
Yeah, they just pay and we don't hear back.
Right. Right. That's nice.
They're nice and quiet, they skate right through with those. We do like AARP.
Just throwing that out there.
Well, and yeah.
They do it a lot.
The other thing we're trained is that they really have to pay quickly because if someone complains about them, that is elderly abuse. And the government comes after them. Yeah. So they do what they're told.
Isn't the owner of that a woman?
I don't think there's an owner. Oh, yeah. Yeah.
Does that apply to everyone, like if we have bills and no payment?
Medicare, people on Medicare. Apparently, you're not an elder until you're on Medicare, according to the government. Yeah.
I was just going to chime in similarly from the nursing home standpoint. We've seen good success with people who have AARP as their secondary because if you come to the nursing home under a Medicare stay, you're covered by Medicare 100% for your first 20 days.
Yes.
But then days 21 through 100, you'll have a copay of close to about $225 a day. And those who have that AARP as a secondary, it's covered by AARP. That
Right.
$100 a day.
Yeah. So no matter which plan you choose, long-term care nursing home, you only get 100 days. And if you don't have a supplement, it's not going to pay at all. But your first 10 days, yeah.
So I'm on Medicaid. We don't have to go through Rocky Mountain. We can go through AARP.
If you want to get the Medicaid Medicare plan from United Rocky, we'll call them, you will get extra benefits from them. They'll give you they call it a U card now, where you can get help paying for your utilities or some of your healthy groceries. They make it limited. It's sort of like the WIC program for the pregnant mothers. You can only get certain things.
So is that considered a Medicare Advantage plan though?
Yes.
Okay, so it is a Medicare Advantage and not necessarily just your straight Medicare.
Right. So you still have to go to the Medicaid doctor that takes Medicare. It's the way they've explained it to me. I told you it's complicated. That's why we're having one.
So I work with the patients, so I'm the patient care plan coordinator, and I work very closely with case management. And I will say, depending on like whether you have regular Medicare or Medicare Advantage, so like let's say we wanted to swing you, which swinging you is like, let's say you have hip surgery or knee surgery, or you break something and you need to stay in the hospital a little longer. If you have straight up Medicare, if you just have regular Medicare A and B, we can swing you after your 3 midnights, no prior auth required, and you have 100 days. You have 20 without a copay, and then after 20, you have your 20%. Now, if you have Medicare Advantage, we have to get it prior auth, and then they watch it and require us to send records every so many days, and then they will say, nope, they're done, they're out. And so you don't have the full, you have the full 100 days, but they get to dictate when you go. Does that make sense? Mm-hmm. And I mean, even with regular Medicare, you know, you might go to you might be swinging, and we're like, you're doing amazing, like you're ready to transition home. So like even with regular Medicare, we would tell you, but with Advantage, the insurance tells. So the insurance can dictate when you go home. And we also have a hard time finding like outside hospital services. So let's say you need home health. So you did your swing bed with us and you rehabbed with us, and we were like, man, we really think you'd benefit from home health for an extra week or two, just to have somebody come in and help you shower or whatnot. If you have an Advantage plan, there is not a single home health company in the area that takes Advantage plans.
Not local, yeah.
Not local.
You have to move to Grand Junction.
No, they don't either. They don't come here anyway.
Yeah.
Yeah.
So that would be a disadvantage of having the Advantage plan.
Very well.
It's just good to check with your insurance. You know, if you have a supplemental plan or you have an Advantage plan, check with them. If you know you're having a procedure, check with them and try to get that information ahead of time so you know what your obstacles are.
Yeah.
After you have the procedure. Or, you know, whatever that may be, what things you need to arrange.
So, but, like, United Health through ARP does cover home health?
Home health, the way it's listed, is covered once you're deemed homebound, if you're just talking regular home health. Outpatient physical therapy type of a thing is different, but you have to find an agency that provides home health that bills Medicare. So I think in Glenwood we have one for, oh, they did? Well, imagine.
There's only a Bode, and they don't do Advantage plans.
Yeah.
So that almost sounds like you're better off not having the Advantage and having a supplemental.
Well, the Advantage plan, it's affordable up front, $0, as long as you don't ever have anything. It's great, because then you have to go to their people and it just makes it a little more complicated.
I was gonna say, on that comment, we've gotten the same question for us, as like, all right, do I pick an Advantage plan, do I not, from the nursing home standpoint? And to your point, well, some of the plans are free, right? So if you're a low
Right.
utilizer of healthcare services, then that's a great position to be in, right?
Right.
But if you anticipate you might have any sort of need for maybe the swing bed services or the nursing home, that's when they become a disadvantage plan, not an advantage plan.
Right. And so in normal counties, we would have at least 10 different Advantage plans to choose from. We have one. And we're kind of lucky to have the one option because we never had it here forever.
Is it more or less like because of where we are situated as the town? We're in between two?
Lack of population, yeah. Even if you move to Grand Junction, they've got Aetna and Cigna and United over there. So they've got the people. But do you want to live in Grand Junction?
No. So is there anything else that I hate to say this, but that the government helps you if you only have that one Advantage option here? Is there any, like,
If you go to Health and Human Services and you can apply for Medicaid, even if you don't fully qualify for Medicaid, you can get low income assistance, which can lower your Part B payment and sometimes your Part D payment. So it just depends what level you're at, and it's going to change every year. Unless your Social Security is going to stay the same, well, it's not. So it's just you got to keep going back and updating them when anything changes.
I'm kind of not getting it, so that how much Social Security you get should dictate if you're a low income or not, right?
That's your income.
So, yeah, and if you have other income too, then you're just out of the ballpark.
Well, yeah, you'd have to go see because of where we live, our low income qualification is higher than in the city where they have lower rent, lower everything. So you have to go check with Garfield County. Yep.
Yeah, I applied for Medicaid, and they denied me because I made too much money. I only made $11,000 last year for the whole friggin' year.
And when did you do that?
This year,
You just did it?
yeah.
Because typically it's based on what you're making now.
Probably making the same.
Yeah.
And they go off of gross, right?
I can't say. I don't want to, that's not my realm.
They take into consideration your assets though, so like if you own your home, then that's considered an asset. And so that does cause some problems for folks sometimes is that you may be income poor, but asset better off. And so that could be a complication.
Yeah, I'm still paying on my home.
Well,
And I have a
then
car.
I would talk to them again and maybe.
Yeah. Yeah.
I just won't get paid.
Try to get a different person this time.
Yeah.
See, you guys warmed up well.
So could we kind of go through a scenario, say like $100,000 hospital bill, and then price it out, what that would mean under the different plans for, say, like a 75-year-old? So say a 75-year-old is paying $200 to $250 per month, would that be about right to get some of these plans like G and L and K?
For 75-year-old?
Yeah, I mean, because that's like higher than a 65.
Right.
And I know it goes up
Yeah.
every year.
Yeah, and that's something to remember. It's going to go up every year. No matter when you come in to get it, it's going to go up. It's just a chart. So that's always going to go up.
So they just plug you in by age?
Mm-hmm. Age and gender. And then the Medicare itself, Part B premium, goes up as the government sees fit. So this year they didn't raise it because last year it went up $9 or whatever. It's one of the biggest increases we've had in the history of Medicare. So they're trying to get back in some people's good graces. But yeah, are you talking about inpatient or outpatient? Let's say it's outpatient surgery.
Let's say it's inpatient, and what I'm trying to do is say, look at what they're paying per year to get the insurance. So like 250 times 12 months. Plus it goes to, if I'm seeing this right, so 280 is the max for the Part G, is that right?
G, for the G, which is the Cadillac, your out-of-pocket is $240, which is the deductible that has been set in Part B for outpatient. So the government sets that deductible. So as that changes, it'll change on G, it'll just automatically adjust. When I first started working with Medicare, the premium on Medicare was $90 and the deductible was $90. So it's tripled on the deductible and doubled on the price.
20 years ago? I mean,
Yeah, 22 years ago.
and it's
Yeah.
gone up that much.
Yeah,
Okay.
yeah. So if it's outpatient surgery and you're on Plan G, you're going to pay your monthly premium and you're covered 100% for the year once you've met your 240, which if you're having outpatient surgery, you meet that in one doctor visit and a PET scan or whatever you got.
Right.
You hit that immediately.
Well, let's say at the hospital stay, so you have to do that. So then is it the 280?
Then you're under Part A. So now you've got a deductible when you get admitted. Was it $1,600 something? Yeah. So if you don't have a supplement or an Advantage plan, you're going to pay the first $1,600. The weird thing, I know you're going to find this so shocking that they have something weird. Part A deductible can happen more than once. So you get a hip replacement and you're overnight. Now, 3 months later, you have a gallbladder and you're overnight again. That's another deductible because it's a new event.
Okay.
Now, B doesn't work that way. B is an annual deductible. So just to confuse you more.
But B is totally not overnight. Is that
Outpatient only.
Yeah. So what is the max for hospital, say with G? So you're saying that'd be is that the 2,800 and then for another plan it's 3,530? So say you have 5 operations in the hospital in a year.
You're on G? If you're on G,
well,
you aren't going to pay anything for inpatient.
Well, this is like overnight in the hospital.
Yeah.
I'm just,
Yeah.
trying to.
You won't pay anything if you have a G.
But what does G cost? Average or range monthly?
Oh. Well, and so every insurance company has different preferences of different ages. So that's why I can only tell you the 65-year-old age because that's what,
Right, the most common.
it's what everyone wants to know. But now once you start changing it, then I would go in and put in your age and where we live and all that, and it'll tell me a couple different companies and their rates, and they will vary at least $50 a month on some of them.
Okay, but
So
is
it's really variable.
Is that kind of the range of difference, though, in a monthly cost?
Yeah.
Each
So like United versus Mutual versus Humana.
Right.
Yeah.
So what is that average cost
At 65.
at age 65?
At age 65, 120 to 150. So I usually say about 130 because we have 175 on the B. You throw in 130, now we're at $300 a month. Then depending on your drug plan, that'll tell you. But that's if you get the G. I've got quite a few people that are taking the high deductible G where you pay the first $2,800 of outpatient. That is $50 a month for a 65-year-old.
Really?
So I've got a lot of people taking it. I mean, $2,800, you can spend $2,800 on the drop of 2 minutes.
Spend that on your
Yeah.
monthly.
Yeah. Yeah, it just depends.
And that G is through,
The high deductible G, only a few companies offer that. I think Humana, United does not. Humana and Mutual maybe.
are these, sorry, I came in late, so
You're fine.
throw out a question here, but is this generally, I mean, I know the numbers are going to change and the supplemental people are going to change, but other states?
Our prices are dictated by our county.
Okay.
So Denver actually pays more for a supplement. I mean, can you believe that? First time ever we get a little break from the city folks. But so every state has their own. So you buy a plan here and now you move to Arizona, right? Now you're going to have to go look at Arizona and say, well, now I have an opportunity to pick new things. Arizona has Medicare Advantage, 10 pages of them to choose from. And some of them are PPO, which means they have a national network. So if you go to a metropolis, a big city, which we live here because we really don't like those, I think, right? You have a lot more options and you can get something that will work as you travel to see people. I mean, you're finally retired and you want to go do things, don't you? Most people.
So that being said, if it's, whether it's in Colorado or whether, this is for my husband and where we're going to be, and we get it in that state, or even if we had it in Colorado, and we travel, are these covered?
The supplement will cover you anywhere in the United States that takes Medicare.
Okay.
So,
But the Medicare, his Medicare will kick in, it kicks in January.
and that's all based on where your primary residence is. So you have to get it out of that state.
So we get it out of there, but if we're traveling to, say we travel to a different state, it's covered. You know,
Yeah.
if something happens.
Yeah, that
Is
you
that
did
covered?
miss that in the beginning. The
Sorry.
supplement does work anywhere in the U.S. that takes Medicare. So you can be in Hawaii, be in Alaska.
I'm gonna make it there,
Yeah,
somewhere, okay.
yeah.
From a billing standpoint, just something that I haven't heard anyone ask yet, one of the biggest questions that I get when Medicare patients call me and they have Advantage plans, they always ask me if they can bill their Advantage plan with Medicare secondary. The Advantage plan, it has the word Advantage, but I want you to think of it as using the word replacement.
Yes.
It is replacing your Medicare. You cannot bill both. So if you have an Advantage plan, it will always be through whatever the commercial plan is. Around here, it's United Healthcare.
Right.
So we're billing your Medicare, United Healthcare, but we cannot bill your Medicare secondary. That is gone.
Yeah.
So just putting that out there, that's one of the biggest questions that I get.
Yeah, even though you have to keep paying for Part B, they basically take it away and take over. And what they have found is they can be more efficient in their running of the program and paying the bills. And then they send what Medicare was supposed to cover back to Medicare. It's crazy. It's pretty mind-blowing.
In Glenwood, I mean, I haven't had any problem here in Rifle, but I don't doctor a lot. Are a lot of doctors in Dartmouth County still taking Medicare?
Medicare itself,
Yeah.
some of the newer ones are hesitating because they get paid 30 cents on a dollar.
Yeah.
So how are you going to get your practice up and going when you're starting out and you're,
Paying medical school.
yeah,
I get
yeah. And in the cities, like in Phoenix, I use that a lot because that's where my dad lives. He goes and pays a concierge service to get into a group of physicians so that he can get access because there's so many people. They can only take so many. So many. Yeah. What else? You guys are asking good ones.
Thank you.
Sure. Yeah. I'll get one back here to her too. It's very confusing.
Thank you.
Uh-huh. What else? We've covered a lot.
So, I recently retired and, I actually went to Social Security and they just automatically take me out of my check. I don't take any medicine. I'm relatively healthy, but in 3 months, I don't know what's gonna happen because, you know, things happen.
Yes, yes.
I want a good plan for my dollar, but I don't wanna pay for crap that I don't necessarily need.
Right.
So I haven't really done anything because I got a Medicare book that's the size of a telephone.
I know. I've seen a couple of them in here.
They think I'm gonna understand this, they're crazy.
They are.
But I don't wanna be underinsured to where I'm gonna get screwed. Is there a plan that won't kill me if something happens?
Do you travel?
Plan on it?
Right, you just retired.
Yeah, I just retired
So,
just a month ago.
yeah, we would have to sit down and look at it and talk about the advantages of the price versus the out-of-pocket and see what you want to do. Because if you pick a supplement, which is what's going to work outside of Colorado, if you ever want to switch, now you got to answer those medical questions. So you kind of want to pick the one that's for your future because you don't know when you're going to need it.
Right, that's my dilemma.
It is.
I could go to the doctor and she put me on 2 medicines or something where I haven't needed anything, but, you know, things happen.
Yeah, and the Advantage plan is protecting you from A and B. They don't have a cap on your out-of-pocket. So that's all you want to make sure you've got yourself protected there. Plus, it's got a built-in drug plan, so you won't be taking the penalty for not having the drug plan.
Right.
So in the, but now you're only covered here.
Right.
So you really got to look at your life and what you think.
Well, I don't want to sit under a rock.
I know. You're finally getting some freedom.
Yes.
Yeah.
Finally.
Yeah.
It's still complicated.
But there's hardly anything more important than your health.
Yeah.
Somebody ran a health food store, told me that years ago. So, the premiums for like a mid-range plan, yeah, I gripe every month, but, the peace of mind you have from having coverage is worth it.
What's your opinion of a mid-range plan? What's
yeah.
a mid-range plan? I don't want to put you in that.
I don't doctor a whole lot, so,
Uh-huh.
and I have in, and now I'm paying $170.40 a month.
170 plus the 174, which if we don't use anything under that 174.
And then a separate drug plan that's $48.70
Okay. A month?
a month.
Thank you.
Started at $13.20 in 2020.
And you should check that because they do.
Do the high deductible G for $50 a month, say, because then she would have all the junk, and then she could do the 0% or the zero
Drug
in the
plan.
welfare.
Yeah.
That's at 0,
Yeah.
Yeah.
and then you've got that base covered, and you would be saving $1,200 a year. So assuming that for 3 years you don't have anything wrong with you, you'd come out on top. Do you know what I mean? And you'd have enough saved up for your $2,800, for the time somebody does have it. Because you'd have $3,600 that you saved up by not paying that. Does that make sense?
Self-insurance.
If you have something going on and you get a bill for $2,800 and you see all the other bills, you're going to feel pretty good about that. That's a dime in the bucket.
So actually, G is the best bang for your buck, really.
G, the reason people like G, they never pay a bill once they meet that 240. So
I say we round up all the geniuses that put this together.
I know.
They're already retired.
Yeah.
We'll find them. Okay. I know people, don't worry.
What do you got?
I just want to double check to make sure. So for our employees that are 65 and over that work for Grand River, we offer a plan that is credible. As long as they're enrolled in that, they do not have to enroll in Medicare until they leave employment.
Correct.
Okay. Now, we
Now.
have a plan, supposedly we're looking at adding a high deductible plan, and they've told me that that is not credible.
Right.
Now, do they pay the penalty for Part A, or is it just Part D?
D.
Just the penalty on Part D? And that's a lifetime penalty?
It's 1%. You're going to like this one too. It's 1% for every month you don't have a drug plan creditable until you come get one. So if it's 20 months, you got a 20% rate up for the rest of your life on your drug plan.
So if you did what she said.
We're just going to confuse you more.
Care for $0 per month, you'd be covered.
Well, here's what I'm seeing. I have employers who have, everybody's working past 65 because it's not time to retire. They can't afford to. So they have their staff go on Medicare, which averages $330, $340 a month. Is usually less than what they're paying to have that staff on their insurance. So they'll reimburse.
Yeah, that's not going to happen here. But
Yeah, they are doing it because they're saving themselves money, and now the employee gets a plan where they have $240 out of pocket. So it's good.
You're saying that if you work at 69, you don't have to go do A, B, and D?
as long as you're covered by.
As long as you're on your employer's insurance.
You can't do all that. Does Grand River hire 80-year-olds?
They did hire someone that was mid-70s, so there's hope. You know, we're not age, what's that called, discriminatory.
Okay.
Gene, we would hire you in a heartbeat.
I'm thinking they would.
This is the quiet side. Okay.
We travel a lot,
Yeah.
and, you know, we're both relatively happy about it. If, you know, if I go across state lines and have a heart attack or get in a bad wreck or something,
I had a client who took the advantage and crashed his bike in California. And because it wasn't life-threatening, but he needed 2 surgeries to fix his hip, he was out 30 grand. He was not a very happy person.
they say they ship you back.
He had purchased the Advantage plan.
Travel. Whereas,
If it's life-threatening, you will be covered. He had a broken hip.
yeah,
Yeah. It's a little crazy. Yeah, I go,
but if you have Part B and Part D, you're gonna be covered. You're gonna have the deductibles or whatever, but you're covered in other states.
yeah, you'll be paying 20% of everything for outpatient.
Okay, and then you can pick up a supplemental for that, or get that G for that.
That is a supplement.
G is a supplement.
Yeah.
Okay,
They call them Medicare supplements, Medigap. Why do we have 2 names for that?
right. So,
Yeah.
where would one go, either in the state, or I'll find out in the state we're moving to, but like to you, I'm assuming, but where do you go to Social Security office to deal with this, or do you go
To deal with
to
what?
to get like a G plan and a D and what we need?
I can send you info of what's available here.
Okay,
and you can see pricing.
And it's individual, like, insurance companies?
Yes. Yeah.
Gotcha. So in a different state, who would I contact to find out who does it?
You can look things up if you can figure it out at medicare.gov.
Okay,
Otherwise, find someone there.
okay.
Medicare.gov is fairly user-friendly, in my opinion, but I'm on it all day long.
And none of this works in Canada, right?
None.
Nothing?
It's not in the United States.
Right, that's what I understood. So you have to get some other temporary.
Travel insurance, yeah. Yeah.
And that's really reasonable.
It's amazing, it's so complicated.
Canada has free health care, yet a lot of Canadians come into the United States and pay for their procedures because they don't want to wait. Yeah. So see what sounds so good? Maybe it isn't.
So, one more question on the Part D. That is gonna be a supplement, you would go to an insurance company, it's not necessarily through.
Drug plans are separate from insurance companies, and it depends on what medications you take, if they will cover them.
Who do you go
So,
to for that?
I do
And
that.
This individual or the insurance companies?
I do it.
You
I do them.
Okay, and you are directly with?
I
Medicare?
represent, I'm licensed with 13 companies, insurance companies.
How do you fit it all in your head?
It's been lots of years. Now I dream about Medicare.
Right. So if a guy wants to make changes, are you somebody where you want to go through?
Sure. Yeah, we look at your options and say, okay, what do you think? What's going to be the best fit?
Well, we pretty well know we got to change.
Yeah, it's a scary world out there.
And where would we come to see you?
I'm in West Glenwood.
Okay. And,
Do you have a card or something?
Yeah, I'll pull those out. Yeah,
thank you.
yeah.
Anywhere from the Vet Canyon to Glenwood now is a crapshoot whether you're going to get through because of the wrecks.
Oh my God, I know.
I still want to know how that semi got going backwards this morning.
It's the tourists, you know. They don't know what they're doing. GPS should tell you, right?
You would.
But it's almost every week now that Glenwood Canyon's closed one way or the other. It's crazy.
Between that and 82 years a minute.
Yeah. Okay, anything else? You feel like we got things covered?
One thing.
Did I confuse you thoroughly? Yeah.
One thing I want to mention is utilize the community's resources as far as hospital discounted care program. Our CICP is a Colorado Indigent Care Program. Those are state funded and they're made for people who don't necessarily qualify for Medicaid, but they're
Right.
still on hardship times. So it goes by an income base and we do that in-house at Grand River. You would submit some paperwork to us and then we can help offset the cost after insurance if it's become a burden on you. Like, there's more than just insurance
Right.
that is available to you to help. So reach out to the billing services at the hospitals you're going to and ask them about what they can do to help you. Because there's plenty of programs going on that we're educated and ready to help. So typically, if you're willing to help pay your bill and make a plan with us, we're willing to help you too. So please reach out to the patient financial
Yeah.
service teams and those types of billing organizations to try to get more help. There's more state stuff available to people. Just because you don't qualify for Medicaid doesn't mean you can't get some help, especially with big ticket bills.
Yeah.
We have one person who's dedicated to that program, who knows the ins and outs that you would work with and apply with from start to finish, and she is amazing to work with. So if you have somebody, you would work with one, and then she would maybe have a team, but you're gonna be interviewing with her to get all of it done. So you
Right.
have one person.
should get you on the right track.
Yeah, and it can help pick up those high deductibles or any large out-of-pockets you may have from a lengthy stay or something like that. So just utilize those programs because they are available.
All right, well, thanks for coming out today.
Thank you so much, Pam.
Sure.
One other thing I wanted to just mention, and I'm going to tap into Xavier for doing this. A lot of people come to us and ask us about, oh, you know, my husband, my mother, or somebody close to me needs full-time care in a nursing home. That is not covered by insurance. That's not covered by Medicare. It's not covered unless you have Medicaid, like long-term care Medicaid, or if you have a long-term care plan. You have to, in order to stay in a nursing home, say you've had a stroke or something and you're not able to recover from that. You can recover, that's where that 100 days come into play. But if you need just supportive care for the rest of your days, then that's when you need to consider how you're going to pay for that. And it can be quite expensive. I don't, Xavier?
Yeah, so, in terms of paying privately, like our care center is $475 a day. To be there, it's not totally, unrealistic in comparison to all the other care centers around. If you were to price shop, it's about, in the $400 range, $500 and $550 range. To Becca's point, each time that you go to a nursing home, you can use up to 100 days if you're on traditional Medicare or the Medicare Advantage plans. If they miraculously let you get to 100 days, then great. But then you have to be well for 60 days before that will reset and you'll get another 100 days available to you, be able to, again, go to a care center for a short period of time. The primary source that we see a lot of people do is if they have good asset levels or good financials, they'll often pay privately until they can no longer pay privately, and then they qualify for Medicaid, and then Medicaid will pay for their stay at the care center in the long run if they have to be there for a long term. So we see all sorts of different types of folks, though. We've got folks that'll come there for a couple of weeks or a couple of months and they'll go home, but we've also got folks that are there for the rest of their lives. So if they're there for the rest of their life, like I said, they're either going to be paying privately until they qualify for Medicaid, or they may have already qualified for Medicaid and they're on that. But those are really the only ways that you can pay for long-term care out of a nursing home is through private pay or through Medicaid, because Medicare just won't cover it.
Any other questions? Well, I really, really would like to thank everybody for joining us today. We're hoping to make this kind of an annual event and hopefully just try to figure it out all along. We have some brochures here on our swing bed program. We have Marissa and Megan here also if you have any specific questions about care here at the hospital and your financial situation. So thank you very much, and we hope you guys have a great rest of your day. Thank you.